Ever been afraid to make small talk with others?
Ever get nervous when meeting new people?
Ever felt like you were being criticized by those around you?
Ever worry about going on a date?
Ever get scared when all eyes are on you and you're the center of attention?
That's how those suffering from social anxiety disorder feel.
Social anxiety disorder is the fear of being in social situations which may cause one to be self-conscious and feel as though they are being judged by others. This fear can be so strong that it gets in the way of going to work or school or doing other everyday things. It is the third largest mental health problem in the world today, affecting 7 to 13% of all people.
People with social anxiety disorder can have both physical and mental symptoms. Physical symptoms include chest pains, increased muscle tension, and they tend to blush, sweat, or tremble around other people. There are also mental symptoms which include being afraid that other people will judge you, worry for days or weeks before an event where other people will be, and being with other people makes them very anxious.
Social anxiety is diagnosed by no other than your doctor or mental health care provider. There is no laboratory test, but rather many questions asked during a physical that can help a doctor diagnose said disorder. One must then meet the criteria laid out by the Diagnostic and Statistical Manual of Mental Disorders. Some of the criteria includes persistent fear of being in social situations where you feel you're being judged, which comes with feelings of embarrassment and humiliation. Recognizing that your anxiety level is excessive or out of proportion for certain circumstances, and your anxiety or distress interferes with your daily life.
One may choose to attend therapy or face it on their own. Regardless, there are many ways to help get rid of or lessen the effect of social anxiety. Some of which are get rid of negative thoughts by challenging them, learn to control breath in order to relax, face your fears whether that's public speaking or simply making small talk, build stronger relationships, change lifestyle in doing things such as sleeping more or drinking less coffee. Also, there are medications but none of which cure social anxiety. Rather, it is helpful when used in conjunction with therapy. Some of the types of medications used are beta blockers, antidepressants, and benzodiazepines.
If one does not get treated, social anxiety can continue on through a patient's life. As mentioned before, it can affect one's daily activities, and if it becomes extreme, some even go as far as dropping out of school or quitting work. There is also a risk of substance abuse, depression, or even suicide. These are extremes, but people like this still exist in our society, and we must be aware of it.
In summary, social anxiety disorder affects many people. So next time a peer is doing a presentation or a friend doesn't seem as comfortable in a social environment, be kind and respectful because anyone can be affected by a disorder such as social anxiety.